and all of you who join wherever you are and whenever you were able to. This is meant to be an informal conversation. I first met Peg Mamoletsane at the end of March. We did an extensive search for Deputy Country Director, and you know how fussy we are. She was the star candidate among a very exceptional group of candidates. We were very impressed with the applicants, and but because COVID interrupted virtually everything, May didn't start until August the 1st. So every week between the beginning of April and even to now, we have a chat, she and I, by Zoom or by Skype. And we've talked a lot about our programs, the foundations, the staff, the beneficiaries, the board, the donors. I'm always raving about the donors behind your back. And so this will be a fun conversation. So, also May.
How are you?
So I'd like to ask you firstly to tell us where you are, what time of day it is, and introduce yourself a little bit to our viewers.
Okay, thank you very much, Peg, and I'm really so excited to be having this chat with you today. I think it means a lot to me also to be sharing with some of our donors the kind of work that we do. Right now I am in Khati, which is one of the most southern parts of districts of the Lesotho country. It's about 180 2 hours drive from Maseru. So because we had this program on reducing early and unintended pregnancies in rural girls in Khati, I had to drive today because we were meeting with some of the stakeholders to be able to let them have a buy-in on the work that we are going to do and see how as Help Lesotho we can be able to bring some of the stellar initiatives into how they work on the activities that they have. So it has been a long day because I think, as you all know, it's already like 5 p.m., 17 hours, and having woken up at 5 to be able to drive from 6 and have that 2 hours and 30 minutes drive to be with the team and the stakeholders. It has been a long way. But tell you what, I am so excited that I am going to be having this 45 minutes, which might be short, but I hope that in the 45 minutes we can be able to have a good time and a good discussion, and it will be interesting. Thank you so much.
And could you tell us a little bit about your background, May, and why you wanted to come and work at Help Lesotho?
Okay, May. First of all, let me say that I have followed Help Lesotho through their different social media platforms, from Twitter, from a very long time. And I always thought, which organization is this? As much as it was having so much work in the rural areas, I always wondered who they were. But I think my interest was because of the background that I have. I really am into development work. I have a bachelor's degree in public administration and sociology, but I think my work has been so much around development, and I'm pursuing a master's degree in development studies with one of the universities in South Africa, where my dissertation is even centered around working with vulnerable groups, young girls, and on how we can be able to build programs that end child marriages, which I think is one of the things when I saw the advert and I saw the kind of work that you do with young girls through Girl Force, I thought this would be a perfect fit for me. So as a development worker, I've been working with different vulnerable groups, including sex workers, including minors, including adolescent girls and young women. And it is so good to also be working with grandmothers. We rarely put them under the vulnerable group But I think with the work that I have seen going through Help Lesotho interventions, I can see the vulnerability that they are going through, and I can see why there is need to be working with our grandmothers. Thank you, May.
So you've been with us for about 7 weeks, and you've spent most of your time going out to the programs, meeting the staff, meeting the beneficiaries, sitting in on sessions. So we talked for 4 months before you came. So now that you have that hands-on experience, what's your impression of the programs and the staff?
I am sorry to say that, Peg, that I think in the talks that we had for the 4 months before I joined, I thought I would say I knew the kind of work that Help Lesotho does, but I realized that it was just a drop in the ocean of the information. The minute you see the programs and you meet with the beneficiaries, you learn so much more from them. I really appreciated the time that we had because I could learn more about what is it that we really need to be working with the different programs, and why are we saying that we need to build their resilience. But the minute you're able to meet with them and you're able to see that, oh, this is what resilience means. We look and we have been having discussions and everything, and we are saying we are building resilience, we are empowering them. But the minute you are with them, that's when you are able to really have a good definition of empowerment, a good definition of resilience, and a good definition of people that you can tell that they know where they are going, especially when it comes to young girls and young women. So being on the programs, it's more fulfilling than just having the information. And you can tell that the kind of programs that we do, the way the people appreciate them, you can be able to tell that it's not just a small impact that we are doing, but it's a bigger impact. And because I think Lesotho and the communities that we work in are not about individuals, but about the community. So when people in the community are together and are discussing the same issues and have the same strengths, how fulfilling is that? You can be able to say, these people are always there to support each other. And that is, it's inspirational.
It's so fun when you're there because they're just bursting to tell you the impact.
Yes.
They can't help themselves. It just pours out of them. Over and over and over again.
Over and over. I was at a grandmother's program last week, and when we were there, they were singing. You can tell that they are happy. Even in this COVID time, they have their masks on, but they still want to sing and share the experiences that we are happy with everything that we are going through. And when you see older people happier, even during these times that most people are going through, then you're just thinking these programs are really making so much impact on the different lives that we are touching every day.
Mm-hmm. Were you surprised at how much the boys and men love our programs? Did that surprise you?
Yes, it did. I think because one, I'll talk about the young mothers program. When I went to one, they had just the training for the young mothers. Then I went to another one where they had the training with the partners. And the partners were more excited than the young mothers themselves. So I thought, and how does this work? And you could tell even from the experiences that they were sharing, especially now during COVID, when there has been a number of issues of gender-based violence, you could tell that they are there to support their partners. They are there to be able to be there for them. And when you talk about gender-based violence, they are the first one to say, we know what is right to do and what is wrong to do. And then you say, okay, we thought we are working with our mothers, but the partners are so much onto the programs, and you're just amazed.
Yes, as a mother of sons, I always love to hear the men.
Yes.
A lot of our donors are interested COVID is affecting countries differently and sometimes similarly. And the situation in Lesotho is a bit difficult for us to understand. It's hard to get information, and our programs have adapted in a very specific way. Could you kind of share with us a bit about the national situation, how Lesotho is doing? And I was looking at the stats this morning that came out. And also how you feel our program adaptations have been going.
Let me start. I think we are having a bit of internet challenges, but I think when it comes to COVID, MEPEG, I think a country like ours that has a number of governance issues makes it difficult sometimes to be working on certain things. That would be the first thing. So when we had the COVID coming in, like with any other country, I don't think we were ready for anything that would be happening. However, there's been a lot of funding coming in. There's been a lot of donations coming in there just to help with the management of COVID. But I still think that our country is not ready. What I really liked and loved about Help Lesotho during that time is they realized that this is a difficult time, and they were looking at how best can we be able to support our kids, I mean our beneficiaries. And thank you very much to the donors, because through the carers care
for caregivers.
Care for caregivers, you realize that there was so much going on when there were the staff were making calls to the staff, the beneficiaries. There were so many things that were going wrong, and from that funding, the funding that went directly to help with the needs that the beneficiaries had, you can tell that Help Lesotho has been able to make sure that it addresses the needs of the people, which is something that I really love about Help Lesotho. Because usually most of organizations will be going towards what does the donor want. But I think for Help Lesotho, we are able to say, what do our beneficiaries need? And from there, how can we be able to make sure that we are able to help them directly with the funding that we have? And at this time of COVID, we can be able to say we have been able to provide more than 1,200 beneficiaries with relief packages. But if we are looking at the indirect impact we made, if we say, for example, that each household has 5 members, then we have to multiply that by 5, and then we are going to get about 5,000, almost 6,000 people that we would say we have been able to help. COVID-19 has been a bit of a challenge, because when we go into the rural areas, we know that most of them usually depend on small day in, day out work. They don't have formal work. So during that time, during lockdown, everyone had to be in their houses. And that meant that there was no food. But through Help Lesotho, the beneficiaries were able to feed their families and be there to provide for their families. So I think with everything that has been happening during the lockdown, we have been able to be there for the staff. For the staff and also for the beneficiaries. Secondly, now we are back on the programs. We have COVID-19 regulations we are using and guidelines that we are using as staff to be able to ensure that we still protect ourselves and we are still able to protect our beneficiaries. Because we have realized that even during these difficult times, they still need so much information so that they can be able to build their skills. They can still be able to know what it is that they need to do, even if it is during the COVID-19 times.
It's surprising to many of us that COVID hasn't spread more rapidly in Lesotho. And I know that part of that is the lack of testing, and part of that is probably the youth of the population. people may get sick, but they may not be as ill as older people. Africa, of course, has one of the youngest populations in the world. So do you feel that Lesotho is over the crest, or that there's lots more coming, or where do you feel your trajectory is going? And I just want to, as an aside, mention that May came to us from working for the Global Fund, and before that she was working out of the country for 7 years. So she has a lot of exposure to a lot of partners and information.
I think Peg, at the moment, what I would say is would be the issue is, yes, we are in this situation, but our testing is really not, it's really not there, because if after we are only able to give out results after 2 days, and we say that we have been able to test around 200 people, it means that our testing is really low. And I think our results are not at that level where we could really be able to rely on them. So I would say right now we are just doing them, but I don't think even if we need to be having any programming centered around COVID results, would be able to have the best programming ever. Yeah. When we look at the guidelines in Lesotho, they even take into consideration that we might test somebody today and the results might come out after 2 months, or they might not come out at all. So I think that already in itself gives us a position that we cannot say the results that we have are really a realistic perspective of what is really happening with COVID-19. Mm-hmm. But I always say to staff and to beneficiaries that the best we can always be looking out for is to be able to ensure that we prevent ourselves and do everything, take considerations of the precautions, so that we wash our hands, we put our masks every time. And if you can see the pictures that we have, even when we have the trainings in the rural areas, would rather have them outside with everyone wearing their masks. We have a tippy taps so that people can be able to wash their hands. I think this is just a way to reinforce some of the precautions that we have to take consideration of. But as of the numbers, I really think that they will not work. And also, this is the time in Lesotho where we are having that session on, we know that we're going to have our flus because we are changing the seasons. But even if you go to the hospital to say, I think I have the symptoms of flu, which are similar to COVID, and you want to test, it becomes a challenge, because you would say, I would test, but then what happens? So I think the situation that we have now, it's really problematic for us to be able to know what is the future with COVID in Lesotho.
And also, this reinforces the fact that what we're doing as management is we're planning just sort of 6 weeks at a time. There's no point in anticipating things, because it's the same here in Canada. We don't really know exactly how things are going to go. And I just also wanted to mention that some of the photos that are on our Facebook feed of the programs are from you. Yes. And as you go around, so it's a lot of our donors love seeing them in real time. They're things that are happening today or yesterday, and we appreciate the effort that you make to do that. Thank you. Thank you. Do you have sort of general observations that you'd like to share with us about coming from other organizations, having it perhaps a different perspective about our staff or our staff training or the way we do things? If there's anything you'd like to share with us about that?
When one joins an organization, I think they are always scared as to how am I going to be welcomed in this environment. So for me, when I came in, I also still had those worries to say, how am I going to fit in? But when you have people that are already grounded on who they are and what they do, then you're able to be a part of a very strong team. But what I really liked, or what I really find amazing, is that each staff member understands their program so well. They understand what needs to be done. They are the ones that are able to say, how about we do this on top of what we are already doing? Because they are with these beneficiaries each and every day of the week, and they can be able to see and see emerging issues. And when they see emerging issues, they don't fall back and say, we will wait for management to make decisions. They come out and say, how about we add something extra for this participants? How about we do that? And that is one of the best attribute I've seen within the staff. And I think that makes it easier even when we come to sit together as management to say, this is where we are going. Even if we have to go to the donors and say, we think this is where we would like to ask for more funding, it's because we know for sure where that money is going to go. Unlike we are just asking, we'll see where it goes. It's because we ask for something that we know is going to benefit the beneficiaries directly and at a time that they really need it more.
When I've said this before, but when I need to lighten myself up, sometimes I imagine our staff debating which population is the best. And it always makes me laugh because they advocate so strongly for their own populations, whether it's grandmothers or herd boys or young mothers or adolescent girls or adolescent boys or child sponsorship or whatever. They will fight to the death for those, and it always makes me laugh.
And that is so true, Peg, because I remember just a few weeks ago, I think last week, they had head boys training. The people that were having that, facilitating that training, you could tell that we are so ready to move with this group because we think they need this, they need that, they need that. So I think it's the love that they have and the compassion that they feel towards the beneficiaries. It's like they have become so much part of their lives and part of their family as Help Lesotho that they are always ready to go to all to the highest mountain just to ensure that they're able to get everything that they need.
Yeah, they're really wonderful. Can you think of one or two things that you've seen in the last 7 weeks, beneficiaries you've talked to, little examples of things that have really deeply touched you?
Last week I went to see the grandmothers program. I was so happy because there were a number of them, and I just asked to have a discussion with the 5 eldest. I think the oldest was 84, and she was just so happy to be part of the program. She was willing to learn every day anything that could be able to make it possible for her to make sure that there is the bridge that is there between herself and the grandkids that she's taking care of is really, the communication works well. So after the meeting, she comes to me and says, but you still look very young. Don't you think you can be able to help me with this? I said, okay, Nkhono, what is it that you would like to be helped with? Says, you know, sometimes you are on your phones all the time. And I have a phone now, so I don't even know how to operate it. We sat and operated the phone and said, okay, this is how you go about it. Said, okay, so now when I get home, I'll even tell them, I know how to operate my phone. I've been able to do. So I think those are small things that you realize that they appreciate. But at the end of the training, what we did was we went to see her house. And from the pictures, I think I also shared in the WhatsApp group that we have, this woman was living in a 2-roomed house. that was almost falling on her. But with the partnerships that we have been building with the other organizations and everything, we've been able to also go through and be able to build a small house for her. And from that small house, when we got there, she said, okay, I am so happy that you are here. Please go through. I am so happy because if it wasn't for Help Lesotho, I don't even think I'll be having this house. So it's those are small things that make you feel how appreciative people are. And you can tell that there is that sense of security for her to say, now I can be able to have a room that I can sleep in without worrying if the house is going to be falling on me. And I think from there, it's the kind of small things that you're able to say, I think there is so much impact that we are able to reach with the different beneficiaries. I think the second one was on the young mothers. They were training on entrepreneurial skills. And as they were working on that, I had a discussion with one of them where she was saying, if it wasn't for Help Lesotho, I don't think I would have been able to survive the COVID-19 lockdown. I had a starter pack of a few things to sell, and I think I was able to sell those things. And because of the replenishment we had from Help Lesotho, I still managed to have my business going, and I was still able to feed my family. So it's those small conversation that you have on one-on-one that you really realize the kind of impact that Help Lesotho is making in each one's lives.
One of our listeners was in Lesotho this past year, and she was wanting to know about the education, and the lockdown and the subsequent disruption to education is going to impact this entire cohort of young people in a disastrous way. We're talking now about how we can, hire some tutors, get them more books. What can we do to keep them learning? So could you just give us a little overview of where the schools are at?
There's been a new calendar that has been circulated by the Minister of Education and Training. And this calendar is saying that all public schools are going to be opening as of the 7th of October. And the school calendar is going to change altogether. We usually had a Christmas break in end of November until end of January, but we are not going to have that break. And I think with that also, it talks about what kind of stress are we going to be putting on our kids. So they're not going to have a break. They're going to be studying until February, March, when they're going to now be writing their examinations. Right now, I think as a Help Lesotho, as at the centers, like you have already mentioned, we are looking into how we can be bringing tutors that can be able to ensure that these kids, as they do their school term now, they can have extra tutors that can be able to skills, because we know that with this time of COVID, there's not much that they could be able to change.
It's a real worry because a lot of the parents or grandparents who save for the school fees have had to deplete any resources they have. They've lost their little bits of income. They've spent their little bits of inventory. They've used up everything. We're currently giving seeds to young mothers and grandmothers and trying to help them. It's spring, so trying to help them with planting. But it's a real worry. So we're having meetings right now, actually, and thinking of how we can help. We were working on the emergent needs of kind of food and communication, sanitation, and COVID education. And now we'll be trying to help people. What can we do right now to keep them moving forward with their lives so they don't get too discouraged? There's another question about how we as an organization are going to adapt to this new situation. One of the benefits about our organization is that we don't have much bureaucracy at all. We discuss the Canadian team and the Lesotho team, we discuss the needs of the beneficiaries, the political situation, the socioeconomic environment, and we can decide right away what needs to be done, and we can operationalize it tomorrow. There's always constraints about procurement or delivery or backup on some things, but we can respond very rapidly. So one of the things we've done in concert with our board is we are doing a lot of short-term planning. We revise our COVID guidelines regularly, and we have kind of reset regularly, so we can be sure that we're staying very, very current with our beneficiaries. The way we have organized all of the programs since the beginning is in their rather self-contained pods, I call them, so that we can alter things in different places at different times very efficiently. We can expand or contract quickly. So we're very well positioned. But I think one of the major issues for us is that the beneficiaries trust us so much that they're able to continue these relationships. We're keeping relationships with lots of former beneficiaries, keeping people motivated, keeping them believing in themselves, helping them with strategies. We have lots and lots of things going on. So it's not so much that we're changing our approaches. We're just adapting and tweaking in small ways that cumulatively are very effective. So I just wanted to respond to that question, Hermé. So finally, because our time is running out and we want to get to see if there's any more questions, as you approach you've got some of the program stuff under your belt and you're increasingly taking more responsibility in the organization. So in the next couple of months, what are you looking forward to most?
I think I'm looking forward mostly at ensuring that we are able to respond to their needs during this time. And I like it when you say that it is not about changing the programs, but it is looking at the situation and being able to deal with the situation as we see it. I think COVID-19 is more or less going to be like HIV when we first heard about HIV in Lesotho, in the sense that it's there, everyone knows it is there, but the biggest challenge is having access to the services that can be able to help us better manage it. So I think it's about how, looking at everything and the situation right now, do we think we can be able to manage COVID-19? And I like it when you also mentioned the issue of looking at different things. Like for now, we are looking at how best can we ensure that grandmothers are able to have fruit trees. Because for them, if they have fruit trees, in the next 2 years, they can be able to preserve and sell jam, sell canned fruits, and from there, they are still able to get something. So I think instead of saying we are moving with the times or changing things, we are looking at how best can we be able to have programs that are running with what challenges we have today, but making sure that whatever we are putting in today is going to make a change tomorrow as we work on now. Yes.
Yeah,
so I think what I'm looking forward to is ensuring that within this time we are able to have everyone know exactly how best we can be able to help the beneficiaries within this time.
We're giving our beneficiaries masks. We're adapting daily to things as we find little ways. Oh, we could increase that. We could move that. We could change that. And it's a lot of discussions and a lot of decision making. But I've told you 100 times, I'm sure, how supportive and interested our donors are. They really believe in the work. They're faithful. I know a lot of charities are struggling, but our donors, they're constantly sending us messages of appreciation or encouragement or just friendship. And it's wonderful in this precarious time of unbelievable ambiguity to know that all sides of our organization are working together. Our board is terrific. Our staff are fabulous. We're thrilled that you've come on in a new leadership capacity. And we have so much strength to draw from. We're so well positioned to help people. And that's all we care about. That's all we talk about. And that's all we spend our time working on. So there's another question that's just come up, if I may, May.
Okay.
One is a congratulations to us on hiring you, which is great, and that you're very impressive. And one is about how we approach Help Age Canada for funding for our grandmother program, and we have, absolutely. But they were not working in Lesotho, and this is one of our challenges. In the donor environment, that very few organizations are working in Lesotho, and very few Canadian organizations are working there. So we have lots of partners that we work with. May has come out of a partnership environment at the Global Fund. We have partnerships with UNICEF, with UNFPA, with a group in Zimbabwe called HEVOS, a group in Germany called GIZ. We have lots of partnerships, and we have a very diverse group of funding streams and support. So that's part of the strength of our foundation. So I hope I answered that question. Thank you for the actual information you said. One of the donors actually said the phone numbers to call. So that's great. So are there any other questions people would have of Mamoletsane? We're open to anything.
Hi, May. I'm just going to jump on here to ask a couple of the other questions that have come in from donors. So one of them wants to know a little bit more about you and wants to know, did you grow up in Lesotho? And do you have children growing up in Lesotho?
I just have to say she has a very cute husband, if I may.
Thank you very much, Meketa, for that question. Yes, I was born in Lesotho, born and bred in Lesotho. I grew up in a town that has the longest waterfall in Lesotho called Simongo. In English, it's called the place of smoke. And then I went to university in Lesotho where I met my handsome husband, as Mepeg is saying. I have 2 kids. Children will always be kids to their mother. My eldest is a son who is 25. He's a chef and has opened his restaurant. I'm hoping that one day when the donors come to Lesotho, they'll be able to go there and try his delicacies. He also tries to prepare some traditional dishes. And I also have a daughter who is doing her 4th year in physical and human geography. She wants to do water resources management, which I think MEPEG, knowing the country, you know that most of our water goes to South Africa, and the little water sources that we have are not really well managed. So I think that would be a good career for her. My husband is with the military, but he's a helicopter pilot. So one day, Mepeg, you can have a ride on the helicopter to go through the mountains. And some of the donors can do that on my husband's skills. Yes, that's who I am personally.
Wonderful, thank you. Now I've got 3 questions in a row, all having to do with COVID. As we expected, that would be sort of the hot topic of the day. So first, have food prices and access to food been impacted by COVID?
Very much so, May. I think as all may know or may be aware, we are landlocked by South Africa. We get most of our supplies from South Africa. So if nothing is coming from South Africa, it's difficult to have access to anything. And I think with COVID-19, the way the borders have been closed and things come in, it has been difficult. Inflation, access certain things. So access to food has been a problem, which I think at this moment we can be able to say that thank you very much to Terra for give us, because they have been able to help us during the most difficult time when the access to food was not there and the prices were really ridiculously high. So things have gone really high, and that also at the same time, it's something that we really need to say, how are we going to be working to responding to that to ensure that our beneficiaries are cushioned against such price hikes.
Absolutely. Somewhat similar to what you were just saying, someone would like to know, are the borders between Lesotho and South Africa still closed?
The borders are still closed, and I think Lesotho and South Africa, we have so many porous borders, which I think has been a biggest challenge for us for transmission of the virus from South Africa into Lesotho. But because South Africa now is at level 1 of their lockdown stipulations, there's been talk that as of the 1st of October, the borders are going to be open. But I think for me personally, I would be worried to say, I don't think Lesotho is ready to be able to have any kind of spikes in the numbers that we have, because I don't think our health system is really so low that we are not even able to address the health issues that we already have. So be another addition of COVID-19, that's going to be a really huge problem. It is good that the borders will be opening. Some of our children are going to schools in South Africa. We go to, like for example, I've been helping my father for the past 3 months to be able to go for his medical checkup in South Africa. But it has been postponed because of the borders. It will be good to have access to such things, because sometimes you don't have access to such things here in Lesotho. But I am also worried about what is going to happen when we have the biggest spikes in numbers, especially to the vulnerable populations that we work with.
Okay, thank you. The next question is from somebody who was obviously following our campaign and communications back in the Canadian spring, when we were saying that the fear level in Lesotho was very high, right? People were very concerned about COVID-19. So the question is, what is the fear level like now? Are people as scared as they were when this first started?
I think people are still scared, Kate, still scared because we don't know what's going to happen next. And as Basotho, we are communal kind of people. When we even had the first lockdown, that is why it was important to share with our beneficiaries the airtime so that we can then be able to
I think everyone's holding their breath.
May, if you can hear me, you've just cut out there.
So I was out. Hello.
Okay, try again now.
Am I here?
Yes.
Okay. I think it's the internet. I don't know what happened. So I was.
Oh dear.
I think
This is sort of like our regular meetings with Lesotho.
fear is still there? Yes. So I was saying that Basotho are very communal people. We believe in looking at each other, saying, oh, hello, Kate, how are you? But with COVID, those are some of the things that we have to be very careful. And I think part of what we do as Help Lesotho is every time we go to a program is to ensure that we also share when we ensure that we make sure that we practice the COVID-19 precautions within the same training. And we also say, as we get home, let us remember to do 1, 2, 3. And I think from there, it is about sharing what we know, but also doing what we know is correct to ensure that they follow the same even when they get back to their homes.
Wonderful. Thank you, May. I know that that was a tough last answer with technology. So that is all of the questions, but we've actually had a few people who have just written in with comments, all saying welcome to the team and welcome to the Help Lesotho family. So people are very excited to meet you and hear from you today. So thank you for sharing.
And as we close, I'd like to thank everyone for joining us. Thank May for looking so lovely in her Sisweshwe after a very long day in the field, and for all the questions and comments and support that we've had. Sometime post-COVID, we would like May to come over and meet you in person. And as she says, if once we can reestablish the donor trips, then some of you can go back. We have a number of people who are just dying to go back, including me. So in conclusion, May, do you have any final remarks you'd like to say to our listeners?
Yes, May, I do. I would really like to thank our donors from my heart. I don't think it's about the kind of work that we do, but it's about them having given us the opportunity to be able to reach to those vulnerable groups. If it wasn't for you, we would have really loved to do so much, but would not be able to do it. And I don't think we have enough words to say thank you. And I hope that the kind of work that we do is able to ensure that you are still happy with what you have sacrificed, because I know that as you give out, it's not that it's because you have it all, it's because you're sacrificing something to be able to help Lesotho, to help Lesotho. And I think from that, I would really thank you from the bottom of my heart for, on my behalf and on behalf of the same staff, because I am sure when I tell them that I had this call, they will be very happy that I was able to represent them. And I'm happy to have joined Help Lesotho. And I think from where I am, I can be able to ensure you that the staff is working so hard to ensure that your dreams through the funding that you give out is also achieved. And thank you very much for having me today. And I hope we can be able to one day come to Canada and meet you in person. Thank you so much.
You can all see why we hired her, right? Thank you. Please stay in touch. We think of you often. We're all working very hard, and your support is invaluable. Have a great day.
Thank you.
Thank you.
Thank
Bye-bye.
you very much, and goodbye. Bye.